Good day, everybody. Welcome to another dose of dental tips of the week with me, Dr. Shervin from Artistic Dental Studio. And today I'm covering the topic of muscle and joint pain and how we can reduce that. Let me begin with the origin. So the pain may come from joints or muscles. What I mean by joints is the jaw joints and the muscles that are connected to the lower jaw predominantly. And uh, let me begin by this. Any problem with the muscles could get back to some kind of hyperactivity in the muscle. And problems of the joints mainly are because of some kind of misalignment between different components of the joints. So, this problem is more common in women and between the ages of 20 to 35. And it is proven that it is related to the stress levels. If you can remember, I talked to you about stress levels in the previous video about tooth grinding and how we can control that. So let me talk about symptoms. There are different symptoms associated with muscle and joint pain. The first symptom is the pain, obviously. It could initiate in the joints or all the muscles connected to the lower jaw, and also it could radiate from this area to the other muscles around, also to the ears, and it could create or cause some headaches, even neck and shoulder pain. So these are the things that should be taken into account. It is not something like quite isolated. It could spread all around. And another thing I wanted to tell you about is these people normally are suffering from difficulty in chewing. It could cause some problems during eating. And another thing is that the mouth opening could be quite limited. What I mean by limited mouth opening is the distance between the top and bottom teeth. Normally it is measured between the top and bottom front teeth, and if it's less than 4 centimeters, we call it as a limitation in mouth opening. And the last one could be some trigger points. There could be some trigger points anywhere, normally close to the affected area, and these trigger points, if touched, could easily initiate the pain. So these are the symptoms of the joint and muscle problems. Now, let me dive into the treatment. How can we control that? Well, there is no definite treatment for these problems, unfortunately. But there are some things that we can do in order to control the amount of pain and discomfort. The first one is to reduce the amount of stress, as I told you before. Another thing that could help us reduce the stress is counseling. So counseling could easily help us get rid of the stress, relieves ours, and just makes us more relaxed and more capable to cope with normal life. The second thing is avoiding hard foods. People actually suffering from joint and muscle problems should avoid hard foods, chewing gums. These are the things that they should definitely avoid. And another thing is they should avoid extreme mouth opening, especially during yawning. That's very important. We ask them to put their hand underneath their chin just to make sure during yawning they don't open their mouth that much. It's a bit hard, of course, but well, that's another measure. The other one is compress. It could be either hot or cold, depending on the nature of the problem. Sometimes the problems are caused because of overflow of blood to the region, sometimes which are like hyperemic problems. Some problems are caused because of reduction of blood flow, which is ischemic problems. And in those two, for hyperemic one, we obviously want to reduce the amount of blood flow, so we use cold compress, and for ischemic ones we want to increase that, so we use hot compress. And your dentist is the person who can easily determine which one is suits you, actually, which one is the best remedy for you. And another thing which is really effective is medication. So there are three types of medications for joint and muscle pain. The first one is muscle relaxants like diazepam. The second one is analgesics like Panadol or something like that. And the third one is analgesics with some kind of anti-inflammatory component like ibuprofen. These are the drugs called NSAIDs, or non-steroidal anti-inflammatory drugs. And be careful, these medications should be prescribed under the supervision of your either GP or your dentist. So make sure that everything is considered before taking these medications. And the next thing that could help in some instances is physical therapy, which could actually help us align the joints and also relieve the muscles, reduce the hyperactivity of the muscles. The next one is your dentist who can help you with muscle problems by making some splints, making some splints for you. You can wear either during the day or during the night or whatever, depending on the type of splint. And this could help relieve the muscles a little bit and reduce the pain and discomfort. And the last one, which could be effective in some instances, could be acupuncture. So as you can see, there are many different solutions for this problem. And I believe the starting point for you could be your dentist, who can help you with diagnosis, first of all, where it's coming from, what's the nature of it, and what could be done about it. And then it may need to collaborate with GP or other healthcare professionals in order to be able to control this situation and get you out of pain. I hope this video could be helpful for you, and please stay tuned for next week's video, and also post your questions down here. I'm always ready to answer all of them. Like us and enjoy your afternoon. Thank you very much, and goodbye.